Hello, my name is Marie Hoyle and I'm a GP practice manager in a busy GP practice. This film is being made for training purposes to highlight two different ways of interviewing and giving feedback to patients following a health check. In the first scenario, you will see quite typical style of interviewing a patient, where the solutions come from the clinician, the nurse in this case. In the second scenario, you will see a motivational interview approach, where the nurse will get the patient to identify their own solutions. This is seen to be more effective, with the patient taking more ownership of the solutions. I'll leave you to watch the film and to consider both approaches and arrive at your own conclusions.
Hi Sheila, lovely to see you again.
Yeah.
How are you?
I'm very well, thank you. Yes,
good.
well.
The reason we're seeing you today, if you remember, about 2-3 weeks ago, was it now, we had your health check?
Yeah, it was about 2.5 weeks ago, yes.
Okay. And when we did the health check, if you remember, we did a series of tests. So things like your cholesterol, your blood pressure, height, weight.
Yes.
And we also had quite a conversation about your behaviours, health behaviours.
Yes, yes.
And what we did then, as we described, we took all the results and we put them into a computer programme.
Okay.
And that computer programme cleverly works out what your likely risk scores could be of developing heart disease in the future. Now, we want to know if it's sort of similar to other ladies of your age or whether it's increased or not. So we've got all the results back, and it does show that there is a slight risk of you developing heart disease in the future.
Really? Is it?
You sound surprised.
Yeah, I am. I mean, because I feel all right. You'd think that if you've got a problem like that, you would feel well, you know.
I mean, this is the beauty of having health checks, that people can be walking around feeling quite healthy, but underneath there could be things going on.
Okay.
The good news is that a lot of the things that I probably think are increasing your risk, we can do something about.
Oh.
So that's good news.
Yes, yes.
Yeah. So the two main things, when looking through everything, I would suggest would be your smoking,
Yeah.
and your drinking alcohol.
Okay.
That of course the risk will go.
Oh. Okay.
Okay.
Right.
So we're just going to talk about your smoking, if that's okay, for a start.
Yeah.
Okay. So how many are you smoking at the moment?
Well, probably about 15 a day sometimes, up to 20, between 15 and 20.
Between 15 and 20?
Yeah.
Okay. And how long have you been doing that?
Oh, I've not always smoked that much. I mean, I've smoked on and off since I was a teenager, but just like kind of socially, you know. But in the last 12 to 18 months, it's increased quite a bit more.
Right. So the fact is that you've smoked since being a teenager,
Well,
but not
yeah,
as heavily as now.
Not as much.
Right. And now you're smoking between 15 and 20.
Yeah, I suppose so, yeah.
So that's quite a lot of cigarettes, isn't it?
Well, if you say so, yeah. I suppose it is, yeah.
I mean, again, the good news is that by stopping smoking, your risk of developing heart disease and other things, which I'm sure you're aware of, will come right down.
Right.
So it is one of the most beneficial things you could do to improve your health.
Okay.
Probably the most, actually.
Right. Well, I suppose I'll have to think about it then. Yeah.
I mean, what we also have found is that going it alone can be quite hard work.
Yeah.
And when we've looked at other people, we've found that those who've had help to stop smoking have been more successful in stopping smoking.
Okay.
And across Barnsley, we're really quite fortunate. We've got lots of stop smoking clinics.
Oh, right, okay.
So we've got them across Barnsley, but we also run some here
Yes.
at the clinic.
Okay.
So I'm just wondering what your thoughts would be about coming along to one of those sessions.
Well, I think it's something to think about. I mean, to be quite honest with you, I don't feel that at the moment it's the right time for me to give up smoking, but I'll certainly think about it maybe sometime in the future.
It's really interesting you saying that now's not the right time. How many people are sat in that chair, do you think, and said exactly the same thing?
Really?
Because there never ever is the right time to stop smoking. Apart from, I mean, without being too doom and gloomy, I would hate you to be in this position years on and regret the fact that you didn't stop smoking now.
Yeah. Well, I'll think about it then. Yes, I'll think about it.
I mean, would it interest you, because I mean, I run some of the sessions myself here at the clinic, and I noticed before you said you worked as well.
Yes, I do. Just afternoons.
Right, so I do an evening clinic here, which might fit in more with your working patterns.
Yeah, well, if you've got, you said there are quite a few clinics and things. If you've got some details, I can maybe take them away and have a look at them and have a think about it.
Okay. Well, before you leave today, I'm going to give you that leaflet.
Oh, okay.
And that describes your health check,
yes,
all your results.
Yes.
But it also lists all the stop smoking places you can go in Barnsley and the one here at the clinic.
Oh, thank you. Right, well, I'll have a look at it.
Great. It's something that it will benefit your health.
Yeah,
I can't stress enough so much. That's really good that you're thinking of doing that. Thank you.
Okay.
Just briefly then with the alcohol,
Yeah.
probably the same thing applies. It's drinking some alcohol isn't too bad,
Yeah.
but drinking more than so many units a week is, and I think you described your levels and they were quite high. Just
yeah.
what did you say you were drinking each day?
Well, 2 glasses of wine or maybe 3 in the evenings. Yeah.
Is that every evening or is that just now?
It tends to be now. Yeah.
Every evening.
Yeah, most evenings. Yeah.
So just what I'd like you to imagine is if you'd opened a bottle of wine
Yeah.
on an evening, in the morning, what's the likelihood of there being anything left in that bottle?
Sometimes there's some left, sometimes there isn't.
Which way is it tend to favour?
Not,
Okay.
I think.
And is that every night?
Most nights, yeah.
Okay. Do you ever have a break at all throughout the week of maybe one night off or 2 nights?
Not really, because I don't sort of tend to go out much, so no, it's usually the same.
Okay. I mean, just like the smoking, by doing something about reducing the amount you drink will really, really benefit you. The good news is that all this is something you can do something about to make your health better now and in the future.
Yes, I can see that. Yeah. Well, I'll really think about it and see what I can do.
I mean, some things that people have tried are just taking having one night, instead of drinking wine, replacing it with a bottle of something non-alcoholic that's really enjoyable. Some of these lovely elderflower drinks, ginger beers, tonics, and drinking that instead of drinking wine.
Yeah, okay. Yeah.
That's something that you maybe consider?
Yes, certainly. Yes, I'll have a go.
Yeah. So even if it's just 1 or 2 nights a week for a start, that is something that could be really helpful.
Okay. Yeah, all right.
Also, we have got people that can support you with the amount of alcohol you drink. There's places you could go if that would help.
I don't think I'm an alcoholic yet, so I don't really think I'll think about it.
Okay. Well, if you change your mind, all the details are in here.
Thank you. I'll take it away.
So just to recap, you're thinking of booking into the stop smoking clinic, which is good.
Yeah.
You're going to replace your bottle of alcohol, a bottle of wine a week, maybe 1 or 2 nights with something like a soft drink, so you're going to do that.
Yeah.
And then it would be lovely for you to come back in maybe a couple of months to see how things are going.
Yeah. Okay. Yeah.
So if you're on your way out, if you want to make an appointment,
Yes,
reception, and we'll see you then.
Yeah. All
Okay,
right.
lovely to see you.
Thanks,
So do
thanks
have
very
that
much.
and
Yeah,
take it with
okay.
you. Okay,
Thank
bye
you.
for now.
Bye.
Hello Sheila, lovely
Hello,
to see you
hi.
again.
Yeah, thank you.
How are you?
I'm very good, thank you. Yes, I'm
Good,
well, thank
good.
you.
The reason why you're here today,
Mm.
as you know, about, was it 2.5, 3 weeks ago?
2.5 weeks I saw you, yes.
Right, it was, wasn't it? Gosh.
Yeah.
And you had your health check.
That's right, yeah.
And if you remember at your health check, we did a series of tests.
Yes.
Things like we took your blood test for cholesterol
Yeah.
and your blood pressure and weight.
Yeah.
And you remember all those tests?
Yes,
Yeah.
yes.
And then we had a bit of a chat about your health behaviour, some of the
That's
things you
right.
did. And then since that time, what we've done, as we said we would, we took all the results and we fed it into this computer programme, which is quite a clever programme. And what that does, it identifies if there's any risk at all to you of developing heart disease at the same risk level of someone your age, or if there's any increased risk.
Okay.
Okay?
Yes.
And so today you've come back for your results, so
Yeah.
we're going to have that
Yeah.
discussion if that's all right.
Yeah.
Okay. Your results show a slight increase in developing heart disease, rather than someone your age. You sound surprised.
Well, yeah, I am a bit, really. I mean, I feel all right. It's, you would think that if you'd got something wrong with your heart, you wouldn't feel very well, you know. Yeah.
It's the beauty of these health checks, because there's a lot of people out there walking around who are feeling quite healthy and well,
Yes.
but underneath there might be things happening.
Oh, I see.
And the reason we want to do the health checks is that we know together there's so many things we can do to reduce that risk right back down. So that's the really good news.
Oh, that's good, yeah.
Yeah, which is why we want to have that discussion
Yeah.
today. Okay. So when we look at your risks,
Mm.
I think 2 of your health behaviours are probably increasing that risk.
Yeah.
You know,
Well, I think I do from what you said last time, yeah.
tell me more.
I think you mean the smoking and possibly the drinking as well.
Okay. Is it okay with you if we just have a chat about your smoking?
Yeah, I suppose
Yeah.
so.
Yeah. Just because I don't understand much about your smoking, when you smoke, how much. Would you like to describe a little bit to me about your smoking?
Well, I smoke about, I think about 15, maybe sometimes 20, between 15 and 20 cigarettes a day. I haven't always smoked that much. It's
Okay.
just fairly recently that I've smoked quite a bit more. Before that, I just used to be what we call a social smoker, where you smoked when you went out, for a drink or something. But now I do smoke quite a lot more.
Okay. So what you're saying there is you've always been a smoker from quite a younger age,
Yeah.
but not always to this amount
No,
of cigarettes.
no.
Can you tell me if that's all right? When this changed?
Well, I think it changed. About 18 months ago when I got divorced. Then,
Okay.
I mean, it's fine.
Mhm.
It was quite amicable, and we're still on good terms, really. But obviously, your life changes, and you then have a lot more time on your own to fill. And I think it's probably that made me increase the smoking.
Okay. So your smoking's increased since your divorce,
Yeah,
which you said was
yeah,
quite
yeah,
amicable, but it's something about being
Yeah.
by yourself more in the...
It is really,
Yeah.
I mean, and I suppose with the drinking as well, really, because you're on your own in the evenings, you know. I mean, I don't go out as much as I used to, so, you know, you sit and unwind and, you know, have a glass of wine and a cigarette, and it's okay.
So there's been quite a lot of changes over the last 12 to 14 months.
Yeah, they have really. Yeah. But I mean, I'm fine. I'm all right about it, you know.
Mm-hmm. So, going back to when you were married, what would your life have been like in the evenings then?
Oh, quite hectic.
Was it?
Well, I say quite hectic. We used to go out at least 2 nights a week. Probably more than that. We'd go out with friends. We used to go to the pub quiz, and then we'd go dancing a couple of nights a week as well, because we were both very keen dancers, which is obviously something that you don't do without a partner, you know. Well, not the sort of dancing we did anyway. No.
It's interesting. Tell me more about what was the dancing?
Oh, rock and roll, jive,
Oh.
and modern and old time, and you know, like you see on street.
Yeah.
All that sort of dancing. Yeah, we got really keen. We used to go for classes as well.
So were you quite a high standard?
Well, I think we were pretty competent. Yeah. I think so. Yeah.
And from the look and the twinkle in your eye, it was something that you got a lot of fun and enjoyment from.
Loved it. Yeah. I really miss it actually. Yeah.
Do you?
Yeah, I do. Yeah.
So, thinking about that, do you ever think about doing that still, doing that again?
I'd love to.
Would you?
Yeah, I would, but I wouldn't. I don't quite know what to do. You know, how to go about it, because we used to go to the local community centre on the 2 nights that we went, and then to a class somewhere else. And it was a place where couples went. So I don't know whether there are other places where you could go as a single person. You know, I don't know. Maybe I could. Find out.
What would you do to find out? So I'm not a dancer. What would you do?
I know. Well, actually, there are a lot of dance places, like dance studios, all kind of dancing in Barnsley and Sheffield are very good areas for dance. You know, both for youngsters and through the age range. You know, and maybe have a chat with someone and ask some questions. You know. I wouldn't actually mind teaching, I wouldn't mind.
Oh, wow.
Oh, goodness. You know, so maybe, you know, I don't want any money, but I wouldn't mind sort of teaching a bit as well with the youngsters who want to do it, you know.
I mean, from what you've told me, Sheila, you've gone through an awful lot. You've been married with a hectic life and all the rest of it. You've moved home, you've got divorced, you've got a job. Sounds like you're a strong woman who sets her mind to something and do it.
I hope so, yeah. Yeah, I hope so.
So on a scale of 0 to 10, if 0's low and 10 is high, how likely now in your head are you thinking, I'm going to dance again?
I'm thinking about 8.
Are you?
Yeah. Why
Yeah.
not? Why not? Yeah. Nothing ventured.
Right. So just describing like your life now compared to your life, how you'd like it to be, what would the difference be?
The difference would be going out doing something that I really enjoy doing, and being with people who have similar interests, and not maybe just sitting every night watching telly.
And with the telly?
And with what?
And with watching telly, what else?
With the drinking and the smoke. Well, you can't drink and smoke while you're dancing, can you? You know, it's like at school, I work at a school, I can't drink and smoke in the afternoons, you know, when I work at school, so. And you don't think about it then.
Right,
you know.
because you'd be safe.
You don't think, I never used to think about it before.
So, I'm going to give you the leaflet to take with you.
Yeah.
It gives all the things we've talked about, all the health checks and your results. But from you, what would be lovely, just before we finish today, is for you just to tell me the one thing you'll do before we meet next time in 2 months to explore this dancing.
Well, I'll go online because I have got my laptop, so I'll have a look online as well for dance academies and studios in Sheffield and Barnsley.
Yeah.
And try and get into contact with them and make some inquiries. I might be coming back and bringing you in as well.
Oh gosh, you'll have a job on. Oh, that's really, really positive. It's lovely to hear that,
Yeah,
and
thank
all
you.
the best with it. And I really look forward to seeing you in 2 months and hearing about how it all went.
Oh, yeah, well, thanks for your help.
No, not at all. Thank you
Thanks,
then.
thank you.
See you then.
Cheers.
Bye-bye.
Bye.